Alright, continuing. It says, within the context of the arrival of the Delta variant of the novel Crown Royal to our shores, the paradigm has shifted where mitigation and management of our outbreak is concerned. This fact is evident in the tightened restrictions imposed by the government on August 19, 2021 in response to the presence of the variant and overflowing CV-19 wards in our hospitals. Such shifts in this ever-changing situation should cause employers in the private sector to reevaluate their approach to protecting their business interests from fallout as a result of this pandemic. So this says the presenters at the press conference convened by the Office of the Prime Minister on August 19 repeatedly emphasized the fact that the current CV-19 vaccine does not prevent the fully vaccinated from contracting or spreading the virus. The clear message was that the vaccines limit the severity of the disease along with the subsequent hospitalizations and deaths, thus preventing further strain on our already stretched public healthcare system. So they have noted very clearly and have said very clearly that this dirty waters does not prevent you from contracting the virus. Right? They have said that clearly. That we will give them that. So it says these conclusions are supported by numerous studies in highly vaccinated countries such as the US, UK, and Israel, where infections, hospitalizations, and deaths are steadily increasing among the vaccinated infected with the Delta variant. So Israel is currently grappling with the fact that nearly 60% of its severely ill CV-19 patients are fully vaccinated, right? So when the PSOJ come out and they are saying that 96% of the individuals within the hospitals are not vaccinated, who is to say that those 96%, if getting vaccinated, they are not going to basically get an upgrade on the level of virus that they have that they might contract? Who is to say that? Where's the study to show that or to prove that? You understand? These are some of the questions that are not being answered or put into display, right? You can read down into this article as well, man. Let me read down a little bit more. It says the data also shows that the fully vaccinated individuals who contract the virus can transmit it just as efficiently as unvaccinated. So it says in light of these facts, we can see that the idea that a vaccinated person, staff member, prevents the introduction of the virus into the workplace is fast becoming redundant because both vaccinated and unvaccinated staff can carry, spread, and become infected in a similar manner, right? This means that the established containment protocols of isolation and quarantine of exposed or infected staff along with the temporary closure of business for sanitation still applies regardless of the vaccination status of the staff. The business operation still suffers as it would if none of the staff were vaccinated. You understand? So they are providing a divide, man. They are providing a divide because if this drug does not stop you from contracting nor spreading the virus, and their only linchpin in which they're hanging onto is that it will reduce severity. What about the people who are asymptomatic? Right? Why are they taking it? Right? Because apparently their immune system is working just as well as how you as ascribe that the drug will work. So why are you trying to get those people vaccinated? Right? Now, the divide is this, that those who are vaccinated are basically saying that the unvaccinated is causing the spike and they are causing the spread. But now we are seeing studies and we are seeing evidently that even the vaccinated can cause the spread, man, and they also can contract it. And we are also seeing studies of individuals who have been vaccinated and have died from it and are basically going through severe symptoms. So the question is, why are you pushing this agenda to get a lot of people vaccinated when it is evident that herd immunity is no longer possible due to the rise of different variants, right? So these are some of the questions that need to be answered. These are some of the questions that need to be highlighted, right? Because these things are damaging people and they are not being recorded, are not being pushed in the media as um, how the acceptance of the drug is being pushed in the media. So we have to ask these questions, and we have to see that clearly there must be an agenda behind it, right? I can't tell you what the agenda is, but you have to look out for it yourself. And that's why the scripture back in 1 Peter chapter 5 verse 8 says, be sober, be vigilant, because the adversary, the devil, goeth about as a roaring lion, seeking whom he may devour. Right? So if you're not sober and you're not vigilant, scripture says, who will pity a charmer that is bitten by a serpent? You understand? So that is to say, if you get caught up and something bad happens to you, you can't say that there wasn't a warning given. You understand? You can't say that the information was not out there to equip you properly with the knowledge to make the correct decision. You can't say any of that, right? So with that, I hope that this lesson was edifying unto the elect of the nation of Israel. I want to say Kalalal Yahweh, Ba'ashem Yahushai, Ba'ashem Kodash. Double honors to the elders and apostles of Great Stone, and salutations to all brothers pushing this work in all sincerity and in truth. Shalom.